So what is an oral case presentation and why is it important? Well, oral case presentations are used as a communication tool at every level of training. When you go see a patient, you do history, physical, review labs, and come up with a plan, and then you present this to an attending or to a colleague. The oral case presentation is how we talk to each other about patients. Every single patient you see needs to be presented. This is an essential skill that is just as important as your history and physical exam skills.
It is a way of showing your understanding about a particular patient and their medical problems, what has been done, and what you would like to do next. It allows you to take the data you've gathered and organize it into an objective assessment and plan. They allow you to voice your clinical reasoning.
Because they are layered with information, the oral case presentation is often what attendings use to assess learners. They aren't necessarily there to see your entire history and physical, but your oral case presentation tells them about what you are thinking and what your approach is. Oral case presentations are context dependent and will follow a different format depending on that context. For example, as you'll soon see, the emergency medicine oral case presentation has a different format from that of internal medicine as well as that of surgery. The oral case presentation is an art and a difficult skill to master and therefore requires training and deliberate practice, and that's why we're doing this module.
This slide is the best description of the purpose of the oral case presentation. It is about the story you tell and the argument you make. Your job as the presenter is to weave a narrative and make an argument. This is a skill that comes with time, and this is the art of the oral case presentation. To weave a narrative and make a compelling point, the emergency medicine case presentation requires certain components, and it should be structured in a way that an emergency medicine attending can follow.
We recommend writing out your case presentation prior to discussing it with your attending if your patient is not sick. The hardest parts of the presentation are developing a clear differential and presenting it in an organized fashion. The trick is to present your case around a differential. To start a presentation, begin with a clear identification line. State your patient's age and gender, list the relevant past medical history, state whether they are sick or not sick, and present a prioritized differential so your attending can follow your argument. For example,
Alright, Dr. Warko, so I saw a 55-year-old male who looks well with a history of diabetes, hypertension, and remote smoking who presents with exertional chest pain. I think he could have an ACS, or, less likely, an aortic dissection, or even possibly a pneumonia.
When discussing your HPI, present relevant details giving a chronologic story. It's important to give a good pain history and to address why your patient is here today. Instead of presenting a long, unorganized review of systems, present a list of pertinent positives and negatives that are organized around a differential.
For the remainder of a patient's history, present only the relevant information. For example, you don't need to list all of a patient's medications, but if they're coming in with a history of atrial fibrillation and have chest pain, I'd like to know what the patient is taking for rate control and for anticoagulation. Similarly, I don't need to know all of a patient's allergies, but if we're treating an infection, I'd like to know what antibiotics they're allergic to.
For the physical exam, summarize the most recent vital signs and highlight abnormals that occurred in the department. Emerge docs love vitals.
Love vitals.
It's true. For the physical exam, summarize it in systems and include relevant positive and negative physical exam findings that support your argument from your differential.
For labs and investigations, do your best to interpret them for your attending instead of just listing off 20 lab values. This is an advanced skill and takes some time to develop. Finally comes the assessment and plan. If you've already provided a differential diagnosis, then simply provide a transition phrase and then jump right into your plan. So what I mean is, say something like, I have a 55-year-old gentleman with chest pain, and what I would like to do is, and then elaborate on your plan. However, if you have yet to provide a differential diagnosis, now's the time to do so.
Try to come up with a plan that does two things. 1, provides further investigations to complete your workup, and 2, provides treatment for any symptoms or any urgent conditions that require intervention now. If you really want to go above and beyond, ask yourself, where is this patient going, and do they need to see a consultant? If so, when?
We're going to use a case to get you thinking about ways that you can improve your emergency medicine oral case presentation. You're going to see a history being taken by our dashing resident, and then we'll show you the physical exam and lab results.